challenging situations, it's good to have something that keeps you grounded. And I found Jesus.
Living in a world without you, there's not even a world without you. Nothing else compares, and nothing's too far beyond repair. When I give it to you, I'm not afraid to face tomorrow, 'cause I don't have to face it alone. Failure's not the end. With you I can get back up again. Nobody like you.
Made it this far by your grace, God. You
carried me through.
I've tried all other options, and none of them compares to you.
No one else like you.
Although it's hard for me to see it all the
way that you do,
but you're helping me see
it's bigger than me.
so that my life will bring honor to you.
So many times that I've tried on my own without seeking you, but I found out the truth.
Outside of Jesus, I'm a lost cause.
I can't go a day without you. Living in a world without you, there's not even a world without you. Nothing else compares, and nothing's too far beyond repair. When I give it to you, I'm not afraid to face tomorrow, 'cause I don't have to face it alone. Failure's not the end. With you I can get back up again. Nobody like you.
I see you moving every mountain, not intimidated by my problems. Looking for an answer and I found it. Ain't no other way around it. Ain't no living life without you.
No one but you, no one but you.
All the glory and the honor, all dominion and the power.
Belongs to you.
Lord, I'm learning how to trust you, even when it's hard to trace you. When situations try to break us, I know I serve a God who won't forsake us.
Teaching and showing me, making and molding me.
Water in the desert, very present help. I'm never by myself. He stayed and never left me.
Times that I've tried on my own without seeking you, but I found out the truth.
Outside of Jesus, I'm a lost cause.
I can't go a day without you. Living in a world without you, there's not even a world without you. Nothing else compares, and nothing's too far beyond repair. When I give it to you, I'm not afraid to face tomorrow, 'cause I don't have to face it alone. Failure's not the end. With you I can get back up again. Nobody like you. Nobody like you.
There's no one greater, my God, my Savior. I can never find another friend that will be closer.
Nobody like you.
Found in him a resting place. Come on.
Nobody like you.
Even if I don't know his plan.
All right. All right. I want to welcome Mr. Trevin Rube.
Thank you so much, sir.
I don't know, we haven't even named this the show or nothing. We're just so glad to be up here in the C-STEM studio. This is where we do a lot of podcasts, and I want to appreciate once Attorney Chris Houston told me about you, and you immediately responded, and that means a lot to me. I want you to know I appreciate that, because I know you're busy, man. You got a lot going on, and don't want to waste your time, but I think what the information that you have, so many people need, in a lot of different formats, people don't have the time to ask the questions. The presenter has the time slotted and got to kind of stay in the box, but there is no box today.
Yeah.
So whatever you feel like we need to do, I got a few questions I'm going to ask you for the listeners, but just introduce yourself to our virtual audience today.
Sure. Yeah. Well, my name's Trevin Rube. I'm a family nurse practitioner. I offer primary care services in a unusual manner of delivery with regard to the traditional healthcare system that we have. My office over on Valley Mills near Cobb's, it's Heart of Texas Direct Primary Care. It's a primary care office like you would receive primary care in most office settings. It's just really ideal for individuals who either don't have health insurance, or even individuals that have health insurance but have a very, very high deductible, where the cost of their care, no matter when they go in, is always, difficult to afford for many people. The better part of the last decade, I've worked in the emergency setting here at Hillcrest and Providence, and then at the freestanding emergency Premier and so forth. And in those settings, I found myself meeting individuals that were needing healthcare services, and they were coming to the emergency room because they wouldn't get turned away necessarily, and they could worry about paying the bill later. And that's not the most ideal way to get care. When you're trying to get, routine care in an emergency setting, you're not going to get the care you need necessarily. Oftentimes you're going to be told, this is an emergency. Here's maybe a Band-Aid to hold you over. Go get set up at a primary care office. Maybe they give you some resources, say, here's how to look at the marketplace to find health insurance in the marketplace, like through Obamacare. Or they might say, here's resources to try to enroll in Medicaid, or here's the community health services we have, like Waco Family Medicine with the Good Health Card. And even then, there's this group of people, kind of that people use the word donut hole all the time for people that fall in the middle of either not being able to afford private insurance or offer commercial insurance through a employer, or not being able to qualify for subsidized services through community health services, Medicaid, and so forth. And so those people that are in the middle, a lot of times those are entrepreneurs, people that are independent contractors. Maybe you could think of realtors or tradesmen like plumbers or electricians that go out on their own, and they have their own business with very few employees, and they can't afford to negotiate group insurance through commercial insurance brokers and things like that. All that to say, I'm not selling insurance. I don't have insurance through my office. What my office does is it's a flat monthly fee for services rendered in my office. Most of my patients pay somewhere between $60 and $75 a month. And if they come in to see me, there's no charge to come in and see me. If they need help from me, they can call me and they can text me. There's no charge to call or text me. And most of my patients do communicate with me via text or via email to let me know they're having an issue, and I'm able to respond very timely. By not utilizing and charging and reimbursing through insurance for the healthcare services that I provide, I don't have to have a whole suite of office people in the back of my office, billers and coders and office manager and things like that. And that frees me up to be able to be more hands-on and helping take care of my patients with selecting treatment plans and medications that are more affordable or suit their situation more customized, I'd say, for their very individual and specific situation, and not trying to provide a regimented, plan that has kind of been given to try to suit the condition and not the patient. We're trying to treat the patient and their condition, not just the condition as the way it normally is treated for most people, to make it efficient for the operation of the office. Also, because if you can imagine how a corporate healthcare office might work, they want to try to see as many patients in a day as they can to be able to generate revenue. For each patient seen, there's a bill. That bill gets sent to insurance, and insurance reimburses for the bill. Well, I'm not trying to reimburse through insurance. I'm not trying to book people all day long. I'm trying to book people for appointments that they need, for the time that they need for that appointment. And I'm able to let them be heard and not try to move people through all day long. We can really sit and work through problems. We can talk about all the different options and not have to set up extra appointments to keep going over additional issues. We can just work it all out and really have more of a conversation than a transaction, if you will.
You brought up a point that I was self-employed forever. When I left the light company, I was a barber on the barbershop for years, and my health insurance was extremely high. And I actually took a job with the workforce so I could have that free insurance coverage, so I could have those colonoscopies.
Right.
And I did that. But a lot of people are just like that now. You know, you self-employed people, when you have to go out there individually, you don't have the leverage like you say. So you at the mercy. If you get a low monthly rate, your deductible is so high.
So yeah.
And so what you're saying is that at your service, you can pay X amount of money a month, and you can, if you need to see the doctor, they can come in there, and all they have to do is pay for the medication or something like that. That is pretty good right there.
Yeah. If they come in and let's say somebody had been ill over the weekend
Uh-huh.
and they had a stomach virus or something along those lines, and they came in dehydrated, and we had to do some IV fluids or, administer some medication, we have to pass the cost of that medication on. I can't afford to, necessarily give away or provide those medications for free.
Yeah.
But I'm not charging exorbitant prices for those. And I'm not really there to sell them either. It's just, if they need them, I've got them, if that makes sense. It's not like we're trying to advertise to sell medicine by any means, but if we do a flu test, I'm not naming any names, but I've seen some bills. Somebody got a flu test at urgent care. They might bill an insurance company over $100 for the flu test, and like $17, $18 is what I'll charge. But that's just the cost of my test, essentially,
Uh-huh.
Just affordable, things. When I charge people, I don't feel bad about it because it feels morally correct. It doesn't feel like I'm taking advantage of anybody for those things, because I'm just trying to charge essentially what it costs for me and passing it through, get them taken care of. My gain is on the long-term relationship. I'm not trying to sell a product right now and make money off of giving advice in that moment. It's about establishing that relationship and having that open line of communication and trying to keep people at work, trying to keep kids at school. You don't have to, for somebody who's got a high deductible and they get sick on a Thursday, they might say, I'll wait and see. If I'm not better on Monday, I'll go and get taken care of. In this situation, if you're sick on Thursday, you call me on Thursday and let's see what we can do to work it out. It's a viral illness. You might still be sick on Monday, but if there's something we can do to fix it, we're going to try and fix it right then and there.
Well, it sounds like to me that you're doing this business because you have a passion for people and not just to make money, because there's nothing wrong with making money. It makes the world go round. But every once in a while, you have to think about the people. And I like what you said about building a relationship, long-term relationships with people. Now, my primary doctor, I've been with him over 20 years. And I've been fortunate. I'm never really sick. I dehydrated twice, but that was because of my stupidity, not drinking fluids. But I see him once a year. And I think that when I go, I always go with my birthday. Whatever my birthday within that week, I say it's time to get that 100,000-mile checkup. And we have a pretty good relationship. My wife told me one time I had some back spasms and I needed some muscle relaxers. And she said, "What you got?" I said, "I'm gonna call my doctor," and he actually did it. And so the relationship with a doctor, patient, is crucial. I wonder if he would have did it if I didn't have that insurance, though.
Well, probably. A lot of times the individual providers, the doctors, the nurse practitioners, the PAs, the people that you go in that provide you the care, a lot of times the only reason that they'll ever really look at what kind of insurance you have is to try and figure out if you can afford, or if the treatment plan that they're formulating is going to be even a reasonable approach for you based on what you're able to do. That don't necessarily worry about what you're paying when you're coming in. Most people don't.
Mm-hmm.
I certainly, working in the emergency room, never thought about it, except for when they leave. When you leave today, are you going to be able to do what I'm asking you to do? Are you going to be able to go see the specialist that I think you need to go see? Are you going to be able to afford getting the surgery that you're going to need to have? So most people that do this work care, and most people that do this work don't necessarily care about how you're taking care of your visit with them that day. They're worried about how you're going to proceed and continue to do the things that they think that you need to do. And I don't know your doctor, and I don't want to speak for him necessarily, but I would say that it's really about the relationship and not about your ability to pay in that moment if they're helping you over a televisit or an acute care issue, over the phone, something like that. But,
I just got a comment. Where is your office located?
It's towards the end of Valley Mills when you're getting closer to Lakeshore Drive, just past Cobb's. There's a little office park right there behind the intersection. Yeah.
Right up, and it's Waco.
Heart of Texas, direct primary care.
And that is, you organize that?
Mm-hmm.
So you're the founder of that.
It's kind of a one-man shop. When people call, they talk to me. And when they come in, I'm who they see. I've got a couple of interns, some college students that come and help on a few days, and some part-time office personnel, but it's oftentimes just me.
Oh yeah. And I do have your information on the screen right now, your phone numbers and your email address and all of that.
Mm-hmm.
I'll scan the rest of it on there, but I think that is pretty good that you have, and he want to know the hours. This is Lee Miles. He want to know your working hours.
It's kind of whatever my patients need. I guess you'd say 8 to 4, 8 to 5, but if, usually I'm out of the office by 4 o'clock, but this Friday I've got a patient who needed to see me at 4:30. So I found some childcare and I'm going to make it work so that I can see them. So just try to be flexible and do what I need to do to help the patients.
Why did you choose this profession?
It was a lot of turns, but I went to school. I was interested in exercise physiology and kinesiology and was learning about that process. And then it was in 2007, 2008, the recession happened while I was a sophomore or junior in college. So I started thinking, well, I've got to support myself now. I met my beautiful wife. We've been together since 2007, I guess it's 17 years, 18 years, something like that. And there's no way I'm going to be able to keep a wife with me if I don't have a job. And I started thinking about my interests and then what I could do. And nursing at that time seemed like a really a good move. And after I got into it, I started realizing what further education and what going to grad school would look like and the type of work that I could do afterwards. So I decided to go to grad school and became a family nurse practitioner in 2015 is when I graduated from that grad school program. And just a desire to help people and use the background and knowledge that I've gained in physiology and solving problems has always been something that I've enjoyed. And fixing broken things. So just translated that into more of a scientific and medical approach.
Can I ask the dumb question?
I don't know.
Asking for a friend.
No dumb questions.
Okay. What's the difference between a nurse and a nurse practitioner? Let's say an RN and a nurse practitioner.
So there's a variety of levels of nurse. So you can have an LVN, is a licensed vocational nurse, which has to be supervised by an RN, a registered nurse, and then they can administer medications and do certain types of assessments. And then a registered nurse is able to do certain types of patient assessments and administer a very wide variety of medications that have been ordered by a licensed provider, like a physician or a nurse practitioner or a PA. Then that training can be anywhere from a 2-year associate's degree to a 4-year bachelor's degree. And then a nurse practitioner, you have to have achieved the RN license, practiced for a period of time, and then have a bachelor's degree, and then apply and enroll into a graduate program and go into this graduate program. And it's either a master's or a doctoral level of training in that graduate program. There's a practicum of hours that you do under supervision of a physician and nurse practitioners through that process of training. And then upon graduation, you have the ability to assess and diagnose and treat most medical conditions. And it's a state by state. You think about the scope of what you're able to do. In Texas, in most states, I think 27 states there's independent practice, but in the remainder of those states, you are required to be supervised by a physician. I have a supervising physician that supervises me, signs off on 10% of my charts. When I have a situation that I feel is complex, that I'm wanting some assistance, I can reach out to him and go over the case and decide on the right treatment plan if it seems like it's outside of what I'm used to treating. But prescribe and treat with most medications. There are medications in Texas that nurse practitioners are not allowed to prescribe, and those are limited to the what we call Schedule II narcotics. So that would be stimulants like Adderall and Ritalin and Vyvanse, and then very strong pain medications like oxycodone and hydrocodone. Now that doesn't mean and those really are the very few limitations. We can prescribe pretty much anything else in the appropriate setting with the appropriate clinical indication, if that makes sense. And nurse practitioners or NPs and PAs, physician's assistants, are very, very similar with their scope in Texas for certain. But that would be the biggest delineation between, specifically to your question, between a registered nurse and a nurse practitioner is the prescriptive authority, I think you would call it, the ability to prescribe, the ability to diagnose and order certain imaging studies and things like that.
Well, that's awesome. Let me say this. I want to thank God for all of you working in the medical field, especially during the pandemic. I mean, what was that like for you?
It was a little scary at first. And then once we figured out how to protect ourselves and wear the proper gear, I worked in an emergency room. It was always kind of never know what's going to come through the door. Really unusual, traumatic things come through those doors. So we already had kind of a mindset of we're here, and shock is often, and not necessarily, you're not always surprised by the surprise after a while, But initially it was very scary from I don't want to get my family sick standpoint. It wasn't necessarily scary to go to work. It was kind of scary to come home, worried that we were going to bring something home, especially in 2020 when we saw how many people were getting so ill so quickly. And then, for my wife and I, we had just had our first child in 2019. So she wasn't even a year old yet. And we weren't sure on the implications on the effect on children of that age. And then that my little one was being watched by my parents when we were at work, and they were in their 50s and 60s and worried about me giving something to my kid giving, something to my parents. So that was a little bit scary. But then going through that, 2021, 2022, the resources that we had lost because of the contraction in healthcare, because of the economies and the effect of COVID on all these things, it was really hard to reemerge from it with fewer clinics. We had lost a lot of specialists that had to leave because they didn't have work to do because there were no elective surgeries. So it made healthcare very difficult, and there was just a lot of people needing help, and we were seeing tons of people in hall chairs. You see somebody come in, used to treating them in a room, but you're so busy, you're starting to have to just put hall chairs out, or see people in the ambulance bay, or see people in the waiting room. I took care of people in the waiting room often. And that was, it didn't feel right, but there wasn't a solution. The beds were full upstairs. There was nowhere to take the people that needed to be admitted. They were in the emergency room because they needed to be admitted to the upstairs. There's no beds. No beds. To put them in. So we were just trying to do our best. And so that was frustrating. So I'd say at first it was a little bit scary, and then it was very frustrating. And we all just worked as hard as we could with the resources we had, and to some extent, it's still going on. We're still trying to pull out, especially at the hospitals, still trying to pull out of that nosedive that we went in.
One thing it was frightening. Once they shut everything down, you say, this is serious. This is serious. And you guys probably were on the front line already seeing the increase. But when they shut everything down that Thursday before Easter, I'm like, something going on for real here. And the insecurity, I lost a grandson to COVID. He was 16 months. And the fact that nobody here could tell you how to maneuver or navigate through a pandemic, anything like that. So every day, news was just so important. I think and it became so frightening to see bodies in bags on soccer fields. And right here in Waco, 18-wheeler, with freezers on it. And I was saying, I would pray all the time for the people that work in the hospital, because I asked my wife, I said, I wonder, she asked me, do you think you could go to work when you know the situation is like that? She said, I don't understand how they can do it. I said, I'm going to tell you this. You have to trust your training. You have to trust your training. When I was electronic technician and I had to, had high voltage gloves and all of that when I'm trying to work and rubber blankets and all of that you had to check, like,
Yeah.
oh, what I could blow up if I hit this. But the first time I actually touched it, my body touched it, and I was already insulated, the confidence. So what was it like walking in that door? Was this, I know you had to isolate yourself and do all of that. When you came home, did you have a routine that you followed?
Usually I would change at the hospital, change clothes before I left the hospital, and then come home and change clothes again in the laundry room, and then go into the bathroom and take a shower. And at that time, I had a routine of working a late shift. So most of the time when I got home, the house was asleep. So it was probably ideal for the situation that in that moment I didn't have to interact with anybody directly and was able to kind of, I guess, in my mind, decontaminate myself in a sense. And then, if I felt even the least bit off, like I was getting ill, just wearing a mask and sleeping in another part of the house and staying away from the wife and kid.
Now, let me ask you this. Now, I know they don't want to frighten people, but it looked like we had a rise in COVID here a few months ago. Are you seeing that today?
Yeah. Well, I don't know about necessarily today, but since I guess about for the last 18 months, maybe 2 years, my personal experience in treating people that have been getting sick with COVID is that it's just a different variant. It's a different virus at this point. It is not the same scary, severely incapacitating illness that it was in 2020. We have been so fortunate to have witnessed the evolution of this virus in a way that is, I don't want to say beneficial for us because it still makes us sick, but it does not make us as sick as it used to. And then you add to that our experience as a community with vaccinations, and then our individual illnesses that we've had. Every time you have an illness, you gain a little bit of armor against it, a little bit of immunity. So between the added immunity of vaccines and then the actual individual immunity of having been ill with it maybe a few times, we're just not seeing the same degree of illness where we're hospitalizing people at the same rate. Back in 2020, maybe more than 25 or 30% of people I saw was admitting to be given oxygen and taken care of in the hospital. In the last 18 months, I mean, it is unusual to send somebody to the hospital to be admitted at this point. Though the individuals that do get admitted to the hospital are most often immune compromised or very elderly, or sick with many other problems, like maybe they have really bad COPD and they have diabetes, and that affects their ability to fight off the infection. So it is not as scary as it once was. That's for certain, and that is from my perspective.
So it's hope that the body adapts. Mm-hmm. The chemistry. My wife was teaching me. She was a science teacher for years, so she was talking about homeostasis. She said the body try to freeze it out. That's why it get chills. And then the body try to burn it out. And I was like, oh, so the body's trying to, on its own, trying to figure out, solve a matrix.
Yeah, one of the reasons we develop fevers is there's many viruses and certain types of bacteria that thrive only at a very narrow bandwidth of temperature. And if you put them in an environment where you are above their upper margin of limit, so maybe it's 101 or 102, and you stay there long enough, that temperature change actually will denature the protein and it will no longer be an effective virus. The other way, when we think about immunity, if you think about the lock and key metaphor, the way our body recognizes viruses whenever they come in is the receptors that are on the viral particle. You imagine it's like a lock, an analogous lock sitting on the side of this virus. And if your body has the key that matches that lock, it can recognize it. And it says, oh, we've seen this guy before. Let's attack it. When COVID came, nobody had ever experienced it before. So nobody's body had developed the key, the ability to recognize that virus entering its body to be able to fight it off at the earlier stage. Now that we've had the experience of being affected by it, infected by it, or immunized for it, we all, not all, but most of us have developed this key, this knowledge of what it looks like. And most of us can fight it off early. So we might only be sick for 3 or 4 days, and it'll be mild illness with aches, maybe a mild fever, little cough, and then better after 5, 6, 7 days. Whereas, 2020, we're sick for 21 days, 30 days, hospitalized, and so forth.
Now, here's a question I've always wanted to ask somebody. You would be perfect to answer this question since you're in healthcare. What is Obamacare? Explain that.
So Obamacare and the Affordable Health Care Act and the marketplace, as we call it, where you can go and enroll every fall. I think it's in November. It is an insurance purchasing opportunity for those that do not qualify or receive commercial insurance through their employer. So if you're one of those individuals that you don't get insurance offered to you through your employer, and you make above the minimum or the maximum number of dollars to be able to qualify for state healthcare like Medicaid, and you don't qualify for Medicare. So you're in that in-between spot. You have the option of going to the marketplace, entering in your financial information about your household, your income, and your debts and so forth. And then you'll be given the opportunity to select a healthcare plan, and that healthcare plan will be subsidized, meaning the government will pay for a portion of it. If it would have normally cost you $600 or $700 a month to purchase this one insurance plan, depending on your situation, it might only cost you $150 or $250, and it will be subsidized. And sometimes that subsidy is direct on the marketplace when you go to select what your plan is. Sometimes it's brought back to you on your tax return, and you're paying more on a monthly basis, but on your tax return, you get a credit and you don't have to pay as many taxes when the tax time comes around. I'm not an insurance person or an insurance broker. This is my best understanding of it. And I would recommend that individuals that are having a difficult time trying to select insurance or decide what's best for them, contact a health insurance broker. There's several here in town, and they can give advice on navigating the marketplace. There's also marketplace navigators that work for the government that you can call and you can make an appointment, and they can call you and help you walk through the process too. It is an excellent solution for some people. It is not an excellent solution for everyone, though. I know that at times whenever I've been an independent contractor that I wouldn't have qualified for subsidies, or not many of them, and it would have still cost me a lot of money. And the problem is with those healthcare marketplace plans, a lot of times you're getting something at a more affordable rate on a monthly basis, but you're given that high deductible, that deductible. For any of you that aren't familiar with how deductible works, if you've got a $10,000 deductible on an insurance plan, that means that until you have spent $10,000 on your own health care, they're not giving you a break back on anything. So if you have to have a colonoscopy and it's $5,000, you're going to pay $5,000 for that colonoscopy, even though you have the insurance. However, this is the reason that it still is advisable to still have an insurance plan of some kind, even if it's a high deductible, is if that insurance company has a negotiated contract with the provider or the hospital that you're getting services from. If I went and paid cash for that $5,000, maybe if I went and paid cash for that colonoscopy, it would have been $9,000. But because I had that health insurance plan, there's a negotiated rate already at $5,000. Now, the insurance company is not paying any of that $5,000, but here I am only paying $5,000 instead of $9,000. That makes sense.
Yeah.
And these are arbitrary numbers. These are numbers that I'm just picking. I really don't know how much colonoscopy costs.
But again, that's why your company is so advantageous to individuals who are not a part of a big corporation. You don't work for Sears or name a place. So we can come to your office, and do we have to have an appointment or?
Yeah, generally, I like to be able to have appointments set so that, like I said earlier, I want to be able to take time with patients. I don't want to feel like we need to rush through anything. But for instance, if any of the patients that I've established with at this point, if any of my patients sent me a message right now or called me right now and said, hey, I don't feel well, I need to come in, I'd say, I'm meeting with Pastor Stimson, and I'll be done, here shortly. I can see maybe at 10:45 or 11. So it's not that we can't do walk in or work in type stuff. It's not just walk in the door and.
So to balance your day.
Yeah, and it's for the patient benefit. It's not necessarily for me. It's not that I need a lot of time. I just want my patients to have the time to not feel rushed and to be able to ask all the questions and not walk out the door with question marks. That's, that's been my experience. Is a lot of times you've only got a 15-minute slot, or maybe if the clinic is not busy, 20 minutes. But even then, first diagnosis of diabetes, that conversation can last hours. It should last hours. It doesn't, because the healthcare system that we have doesn't offer that ability, then say, oh, we need to see a diabetic educator. I mean, it's just more appointments. You just got to keep making more appointments to be able to get taken care of. So that's why it's not necessarily like a just open the door, walk in and sit down and I'll take a look at you. I probably would.
Yeah.
I probably would. I'm just saying I'd prefer to be able to make appointments, just so that we can have the time to plan, sit, talk, and then have to follow through.
Again, let me ask you this, because I got somebody that just got on, was asking this question. Your service, your prices are?
For most adults, it's $75 a month. I've almost always got some sort of sale or special though.
Uh-huh.
So, some sort of, go to the Facebook page and there's usually a discount link for something on one of the posts. But that's the general rate for adults. Now, currently, because I am still moonlighting in the hospital, ER, and urgent care on the weekends, this is really frustrating. It's a federal law. This is not a decision that I made. This is a federal law, but I currently cannot take any patients that have Medicare or Medicaid in my office, or TRICARE. So any federal backed program, I cannot see any of those individuals in my office while I continue to see those individuals in the hospital because of federal reimbursement requirements. I can't charge cash patients that have those insurances as a background. And the goal is in the next 6 to 12 months, I'll be able to unenroll from Medicare at the hospital. I won't be working there anymore, and I'll just be in my office. Once I unenroll, that requirement is gone. I can see anybody from any walk of life. But for now, it's that. So with that being said, over the age of 65 will have a higher cost of care because there'll be higher utilizers. And then children under the age of 26, if their parents are members, it's a reduced cost of $50 a month. And then for each additional member, see, have a couple, let's say a husband and wife, there's a $10 discount for the second person. So it wouldn't be, if it was 75, for instance, it would be 75 and then 65. And then if there was a child, instead of 50, it would be 40. And if there was an additional child, all the children after that would be 30 each.
Oh, that's not bad. Well, finally, I know you're busy, man. I know your phone is probably beeping or whatever, but I would ask you this. Why would people choose your service if they already have insurance?
They'll have the direct access, the ability to call and text me when they have an issue and not have to worry about trying to make an appointment and not having the ability for days or sometimes even weeks, some people will tell me. And because I'm not trying to bill insurance, I mean, there's a lot that I can do over the phone. I mean, there really is. Send me a picture of the rash, let me take a look at it. I think it's this. Why don't you try this? And I'll see you on Monday. It's not that we're just not going to see you, but you don't necessarily maybe have to urgently come in today or tomorrow. Let's try this treatment, and I'll have you come in on Monday, and we'll double check and make sure everything's looking good. That makes sense.
Oh, yeah.
Whereas if I was in an insurance-based office, you're taking on liability of treating patients, but you're not being reimbursed for the liability or the work that you're doing. In my line of work, the relationship is established. The relationship is there. You've accepted my services and the agreement, and you deserve this based on our conversation that we had when we set up the relationship. You deserve for me to take care of you right now over the phone. And if I need to see you today, I will do my best to work you in that day. And if it doesn't work that day, I guarantee it will the next day. Well,
that's pretty good, because for years and years and years and years, only time I would see my doctors for a physical, I was fortunate. He never sick. Don't get a headache. I know how to read my body. When my body says time to rest, I rest. If I'm not drinking enough water, I start drinking, So that would have been, I wish I would have known about this earlier. But by the same token, if I still would have had to go to the hospital for anything, but just to have access, because sometimes It's like the flu shots. They charge, like you mentioned earlier, they charge so much money for that, but it really don't cost them much. When you get a free flu shot at your neighborhood drugstore, and a lot of those services that you provide are just right on point with basically what people need. Because if you need a major surgery, that's something that you're gonna have to really plan for anyway. And just to be able to come to your office and set that up, so I got access, kind of like the commercial on television when they can just, hey doc, I got a rash right here, and they send it to the website or whatever. Is that kind of what you do? Or do you do anything like that? Have you had that happen?
I mean, I've had patients say, hey, in fact, on Labor Day Monday, one of my patients said, hey, I've got this painful rash, and sent me a picture of it. And I was like, pretty sure that's shingles. Let's take a look at it tomorrow, but here's what you need to do to take care of it for now, so definitely, but only those services though are only for patients that I have seen. I need to have the background knowledge of the patient and have examined them, once before to at least kind of have that baseline. That's exactly what I'm talking about. Is there are many things that you don't necessarily have to touch or have to feel or have to
come to the office
in that moment. You still want to at some point.
Yeah.
You don't have to make it an urgent type thing. Let's do it when it's convenient for you within a reasonable amount of time. It's not dangerous for your health. If that makes sense.
Oh yeah.
And with the patients that have insurance, this service is not for everybody. People like yourself that only need to get seen once a year and don't get sick.
I don't qualify. I got Medicare.
Yeah, exactly. But people like yourself that don't need to come in very often, this might not be the best solution for them. I'm not trying to push, trying to not have business, right?
Yeah.
But again, I want to go to bed feeling good. I don't want to feel like I'm taking advantage of anybody, right? But for individuals that do, have illnesses that they find themselves going to urgent care 2 or 3 times a year, or they're taking their kids to urgent care 2 or 3 times a year because it's too difficult to get in their pediatrician. Even if they have insurance, that time that they lost sitting in that waiting room waiting to see somebody that they don't know, and the days that they waited before they decided they were going to go in, that earlier care, timely care, that quality of care with the person that those are the benefits for this type of program.
Well, I'm definitely going to be talking to my wife, and we're going to come to your office and sit down because she has lupus and rheumatoid arthritis, and sometimes she can't get to her doctor, can't see her for, come back next month. Well, you in pain right now, take the pain medication. But let's say if I wasn't on Medicare and I came to your office, you're going to do a complete physical analysis, blood, and all of that.
Yeah. Oh, yeah. Complete physical exam, especially on the first time. Now, for focus needs, if you come in for a cough, we're probably not going to be, taking a look at your knee reflexes and everything, But, the first time, it's a full physical. And then as needed on an annual basis, at least, repeating that. But then when needed for episodic care, coming in and whatever is appropriate that needs to be examined, we examine it. Lab work based on age and risk factors. Lab work that we do, if you have insurance, I'll send people to Quest or use LabCorp and have their insurance process their lab fees, and the insurance pays for it. So insurance, things that I order, insurance pays for. Medicine that I order at the pharmacy, insurance pays for it. Imaging that I order, insurance pays for it. So for those people, we do it that way. For individuals that don't have insurance, I have a negotiated contract with the lab that if I draw the lab and I pay the lab for the lab fees, I get a huge discount on the lab fees. So I just pass that cost on to the patient. If we need imaging studies, we've got Touchstone Imaging here in Waco by Providence. They've got pretty decent cash prices that I've got a list of what they could expect to pay if they go in. Looking at just trying to utilize the resources that we have here and trying to find the most affordable way to use them for those patients has been part of the whole setup of this process.
Well, this is good information. This is definitely good information because I never thought about it like that. Where were you 20 years ago? But I want to appreciate you for taking time out of your schedule. Is there anything else you want to conclude with before you leave?
No, I just want to emphasize that this program is trying to make healthcare and primary care affordable for the people that are really falling in that middle, that spot where they don't qualify for state services, but they also don't have an excellent insurance plan. In addition to that, there are half of my patients that I have health insurance. They appreciate the ability to take time and talk about it. And the last thing that I really want to emphasize is that I'm not trying to knock on the current healthcare system. I'm only really trying to highlight why I'm doing it the way I'm doing it. It's just a little bit different than that. In fact, my wife and many of my friends work in that system, and I'm not trying to say that any of them are doing anything wrong. They're just trying to work within the cogs of the system that they're put in. Most of them, probably all of them, went into the studies and the business that they've gone into because they care and they want to help people.
Right.
But at the end of the day, they're given an agenda by somebody else of how to kind of operate their day, and they have to find a way to fit within it. So there's limitations in healthcare being provided in that setting because of that system. But I'm not trying to say that any of them are doing anything wrong or bad or unethical. It's just for the cash patients, especially. Those are the people. I grew up. My mom was a realtor when I was a teenager. We had some health issues. Didn't have access to health insurance. This was kind of a crisis for us. When I was a college student, it was before the Affordable Care Act. I didn't have health insurance, and that background and all those people that I've seen over the years that were struggling to figure out the follow-up that they were going to get leaving the emergency room or the urgent care because they didn't have an insurance plan. It just has always ridden in the back of my mind in a way that I finally decided that I was going to try and do something about it. And this is that effort of trying to find a solution for that individual, for that group of people. Not to say that anybody else still can benefit from that program. And then I'm happy to meet with people for a first time kind of consultation to discuss it about their specific healthcare situation, about my specific abilities and what I do.
Uh-huh.
And if it's a good fit, then we can proceed with doing an exam and setting up that relationship. And if it's not, they can move along, and no hard feelings and no cost for the discussion.
Well, you know what I want to do? I want to have a health and wellness clinic where, especially with men don't really like going to the doctor for some reason. And I definitely want to invite you to that, so we can have a crowd of people that, can sit down and ask you questions, and they can get to meet you and the services that you provide. So I want to appreciate you for taking time to come here to be with us today. And could you tell the people again the name of your business and the location and working hours?
Yep. Heart of Texas Direct Primary Care, 2040-2040 North Valley Mills. That north part's really important. You end up at Pet Boys if you go south. And it's just past Cobb's on Valley Mills as you're getting closer to the lake. My hours are Monday through Friday, 9 to 5, I guess you'd say. But if I don't have appointments, I'm not always necessarily sitting in the office if there's not any work to be done. I live on a small piece of property out in the country, and there's always work to be done. I've got swim lessons with my kids. There's always something I'm doing. But generally between 9 to 5, I'll be happy to see patients in the office. I'm accessible essentially 7 days a week by text and phone call. Even the evenings, if somebody sends me a message, I'm probably going to respond to it. If it's too late and I'm asleep, see you in the morning. But yeah.
Well, thank you so much. I want to appreciate all of you for listening. Hey, it's a good dude right here. You need to go check out this service and spread the word that you can actually make cash payments monthly for some medical assistance instead of waiting on the big tsunami bill to come out. You can get what you needed. All right. Thank y'all for listening today.
Thank you.